Although most people realize that physical activity and exercise have health benefits, they also have risks. This module is used to highlight the musculoskeletal and cardiovascular risks associated with physical activity. As with vaccinations and other important public health efforts, if physical activity is to be a public health priority, the risks must be as fully understood as the benefits. Has anyone experienced exercise injury in the past? If so, how did this affect you physically, psychologically, mentally, etc.? The benefits of physical activity are remarkable, particularly its ability to lower the risks of chronic diseases, and now research continues to teach us about these and other positive outcomes. Meanwhile, knowledge of a downside to any program is critical to having a complete picture. Two primary unintended consequences of physical activity that have been extensively studied are musculoskeletal injury and exertion-related sudden cardiac death. That is, musculoskeletal injuries and sudden adverse cardiac events are two important risks of physical activity participation. Studies of musculoskeletal injury prevalence and incidence must take the population at risk into account. The table on this slide shows the percentage of participants reporting a musculoskeletal injury by type of physical activity. By asking respondents what they were doing when they became injured, the investigators were able to compare various types of common physical activities. Obviously, each of the reported activities is fairly safe. Fewer than 3 people out of 100 were injured in any 30-day period. Outdoor bicycle riding appears to be the least risky activity in terms of musculoskeletal injury, and weightlifting was the riskiest. What is a physical activity-related musculoskeletal injury? A physical activity-related musculoskeletal injury involves some type of acute disorder in a bone, muscle, joint, or connective tissue that is attributable to physical activity or exercise. Such injuries can occur suddenly, such as an ankle sprain, or over a period of exposure, such as a gradual pain in the shoulder of an electrician who frequently works over his head installing circuits. Ligament tears, sprains, strains, bone fractures, bruises, and joint dislocations are common musculoskeletal injuries that can result from physical activity and exercise. Then, why is it difficult to compare studies that have focused on musculoskeletal injuries? It is difficult to compare studies because of inconsistent definitions of injury and variations in the site, severity, and classification of injuries across studies. We also need to know the numerator monster when it comes to study musculoskeletal injuries. What is the numerator monster, and how is it related to studying musculoskeletal injuries? Epidemiologists rely on cases numerator as well as the population at risk denominator to calculate prevalence and incidence. The numerator monster problem arises when injuries are counted, but the population at risk, the denominator, is ignored. As with other health-related outcomes for physical activity and exercise, risk factors conveniently can be classified as modifiable, things that can change or be changed, and non-modifiable, things that typically can't be changed or are difficult to change. What are 5 modifiable and 5 non-modifiable risk factors for physical activity-related musculoskeletal injuries? Modifiable risk factors include the following: amount and type of current physical activity, cigarette smoking, low physical fitness level, improper use of protective equipment, and adverse environmental conditions. Non-modifiable risk factors include the following: age, sex for some types of injury, history of injury, amount of physical activity in the past history, anatomical factors, and environmental external conditions. We may consider this question: can these injuries be prevented? To answer the question, we need to understand the relationship between kinesiology and musculoskeletal injuries. The exercise physiology principles of overload, adaptation, and specificity are important considerations in understanding the risks of exercise and physical activity. For example, the type of physical activity influences the risk of injury. Low-impact weight-bearing activities, like walking, or non-weight-bearing activities, like swimming laps, cycling, are thought to be associated with the fewest musculoskeletal injuries related to physical activity. In contrast, running and sport participation may carry a much higher risk of injury. Then, how do the basic principles of exercise physiology, overload, adaptation, and specificity help us understand the risk of musculoskeletal injuries related to physical activity? The principles of overload, Adaptation and specificity outlined in Chapter 2 are particularly relevant when discussing the prevention of exercise-related musculoskeletal injuries. Overload, or exercising beyond usual levels, stimulates bones, muscles, joints, and connective tissue to increase their function. If this overload is sustained or repeated frequently, the body adapts to a new normal based on the physical training. Adaptation can be focused on specific areas of the body for improvement, such as the lower extremities,